Dear students and my teacher friends, Namaskar. I welcome you to the presentation lecture on fibrous joint. Now the first point, what are the fibrous joint? So this is the first point of our discussion. What is fibrous joint? Now in the fibrous joint, between the bones, there is no synovial cavity. So synovial cavity is absent between the bones in the fibrous joint, and between the bones dense irregular connective tissue is present, and in this connective tissue many collagen fibers are present. So the definition for fibrous joint, that we can say, between the bones no synovial cavity is present, and in between the bones the dense irregular connective tissue is present, and this connective tissue is rich in collagen fiber. This is the first point, the definition of fibrous joint. Now moving on the second point. Now the other name for fibrous joint are also known as synarthrosis. Fibrous joint also known as synarthrosis. Now here, what happens in this kind of joint? See, the two bones, they are bound together by the collagen fiber, and here all the detail you can go through this, but I am directly explaining what they are saying. That here, for example, this is the this one is the tibia and this one is the fibula. Then also between the radius and ulna. For example, here this is the radius, this is the ulna, and as you can see, in between radius and ulna, interosseous membrane is present. Now what this interosseous membrane is made up of? So it is composed of collagen fiber. And from where this collagen fiber are arising? So collagen fiber, they originate from the larger bone, that is radius, and then they attach themselves to ulna. So collagen fiber originate from the larger bone, then they pass through, and then they cover the smaller bone. So that is the meaning of this thing that they are writing over here. Here, as you can see, they are explaining the fibrous joint and what is actually happening in fibrous joint. That between the two adjacent bone, from one bone the collagen fiber are emerging, and they cross the space between the bone, and then they penetrate into the other bone. Okay, so between the radius and ulna and tibia and fibula, the interosseous membrane that are present, they are made up of the collagen fiber. Okay, that is the meaning of this line. Now there are three types of fibrous joint. One is suture, second is gomphosis, and the third one is known as the syndesmosis. Now in the sutures and gomphosis, the collagen fibers are very short, and since the fibers are very short, they allow little or no movement of joint. So in sutures and gomphosis, what we are remembering, the collagen fiber are the shorter one, and they are allowing very little or no movement of the bones. Now in case of the syndesmosis, the third type of fibrous joint, the collagen fibers are long, and the bones which are attached with this collagen fiber, they are more mobile. So in the third type, syndesmosis type fibrous joint, collagen fibers are long and they allow more bone movement. Okay, so that is the meaning of this point number 2 and 3. Now here, sutures. Now first of all, where the sutures are present. So as you can see in the screen, this uh, suture is present between the skull bone. So in our skull, the sutures are present. Okay, so and what are the sutures? So sutures are the immobile or the slightly mobile fibrous joint, and they are closely binding the bones of our skull to each other. And in between the skull bone, the sutures are present and they are not present anywhere else in our body. So they are only present between the skull bones, the sutures are. Now moving on the fourth point of our discussion. Now the sutures, the classification of the sutures. So the sutures can be classified into serrate suture, lap suture, and the plain sutures. Now here, if you are familiar with the working style of the carpenters, now we know the carpenters, they generally work with the woods, and how during the furniture making they are joining the different types of wood, how the edges or how the surface of the wood they are making and how they are joining. So if you have idea about that, then you can easily understand these three type of sutures, that are the serrate, lap, and the plain suture. So nevertheless, don't worry about if you don't have any idea about the carpentry or the furniture work. With the figure we can understand this thing. Okay, so this is the first suture they are showing. This one is the serrate suture, and here you see this two piece of wood they are showing. For example, this is one wood block and this one is another wood block, and dovetail. So now you see this, what is the meaning? Okay, so how the edge of the wood and how the depression is present in the other piece of wood and how they are joining to each other. So similar way in this serrate suture, one bone, okay, the edge of one bone is penetrating in the depression of the other bone. Okay, so this is the first type. This is the serrate suture. Okay, now here serrate suture. So serrate suture appear as a wavy line along with the adjoining bone firmly, and the bones are interlocking each other, okay, by their serrate margin. Okay, and if you play the jigsaw puzzle, the you might remembering then how the pieces of the jigsaw puzzle they fix into one to another. So that way the serrate sutures are, and they are also analogous to dovetail wood joint. Now in dovetail, for example, if this is the one piece, so another piece will be like this. Okay, and this piece can easily fit over here. So this is the meaning of the dovetail joint. Okay, now the example of the serrate suture. So coronal, sagittal and lambdoid sutures are the example of serrate suture. So I am showing you lambdoid suture, for example, lambdoid suture, example of serrate suture. So lambdoid suture, where it is present, so joint between occipital and parietal. This one is the occipital bone and these are the parietal bone. So between the parietal, or we can say the parietal bone and the occipital bone joins together with this lambdoid suture. So lambdoid suture. Then coronal suture. Now where this coronal suture is present? So frontal and parietal. This is the frontal and these are the parietal. So where the frontal and parietal bone meet, this coronal suture is present. Okay, coronal suture. Then the sagittal suture. So here the sagittal suture is shown. This one is the sagittal suture. And where it is present? So joint on the midline where parietal bones meet. So this one is the parietal bone. This one is parietal bone on the midline where these two parietal bones are meeting. There the sagittal suture is present. Now, so this was the lambdoid. Okay, then this is the coronal and this is the sagittal suture. So these three, once again I am zooming this so that you can see it properly. Now you can, okay, all the names and all the sutures. You try to remember all the names and the sutures. So this was the fifth point, okay, regarding the serrate suture. Now moving on the sixth point, lap suture. Okay, first of all, where the lap suture is present. So you see over here they are showing the lap suture. This one is the lap suture. Okay, and the carpenter with the piece of wood, this is the piece of wood, okay, and this one the other piece of the wood. So as you can see how this, both the surface of these two wood pieces are smoother one and they are just joining to each other. Okay, so in lap suture what is happening? See, the lap suture occur where two bones have overlapping bevel edges like a meter joint in carpentry. For example, this edge, okay, when we fit, so this will overlap the other edge. So one edge is overlapping the other edge. Okay, so in the meter joint in carpentry, similar way in lap suture what is happening? This is the bone and this is the edge of the bone. So this edge is overlapping the edge of other bone. So that thing is happening in lap suture. So you can go through this information. Okay, and lap suture appear as a relatively smooth line. So you can see this one, or over here relatively it appears relatively smooth line. Now example of lap suture is the squamous suture. In the figure I am showing you squamous suture, but where this squamous suture is present, so where the temporal bone meets the sphenoid and parietal bones. Okay, squamous suture where the temporal bone meets the sphenoid and the parietal bone. So in the figure I am showing you, for example, first of all, this one is the parietal bone. Okay, parietal bone is shown, and squamous suture. The articulation between squamous part of temporal bone and parietal bone. So squamous suture is present between the temporal and the parietal bone. So you follow this black color arrow. See where this arrow is ending. So the arrow is ending this part, this suture. Okay, this suture is the squamous suture. Okay, so you can see the edge of one bone. Okay, for example, this is the temporal bone. Okay, so the edge of the temporal bone covering the edge of the parietal bone. Clearly you can see this, the edge of the temporal bone is smoothly covering the edge of the parietal bone. Okay, so that is the meaning of this suture. So squamous suture between the parietal and the temporal bone. So this was the theory point. Now, third type of suture, that is the plain or the butt sutures. Now, in this type of suture, what is happening? Where they are present, this plain suture. So, where the two bones have straight, non-overlapping edges. So, we are having one bone, we are having second bone, and the border of both the bone, they are just touching to each other. That's it. For example, intermaxillary suture. Now we know in hard palate, in the formation of hard palate, there are two maxillary bone. For example, this is maxillary bone and this is maxillary bone. Now you see the border of two maxillary bone, they are just touching to each other, and this suture which is present between the two maxillary bone, so we can say this is the in between, that means intermaxillary suture. Okay, and this intermaxillary suture is present in the roof of the mouth. Okay, and in carpentry, like two boards glued together in a butt joint. For example, in carpentry, this is a piece of wood. Okay, and this is, so both the edges, both the edges are in fact very smooth and they are just touching to each other. That's it. Over here, okay, this is one bone, this one is the other bone. Okay, and both the edges are touching to each other. So this is happening in plain suture. So intermaxillary suture is the example of plain suture or the butt suture. One more figure is there so that you can get the idea. See, over here, intermaxillary suture. This one is intermaxillary. So this is maxillary bone, this is maxillary bone. Between the maxillary bone, intermaxillary suture is there. Okay. So this is the 7th point. Now moving on the 8th point of our discussion. Now with this we have completed the discussion on the sutures. Now the second fibrous joint, that is the gomphosis. Now what are the gomphosis? See, our teeth are not bones, okay, but our teeth are arranged, they are present in the socket, okay. So once again, our teeth are not the bones, and the teeth are present, they are fitted into the sockets of the jaw. So the joint between our teeth and socket, that joint is known as the gomphosis, okay. So gomphosis, as you can see over here in the figure, this is our teeth, okay, and this one is the socket of teeth. So teeth is present in the socket. So between the teeth and the socket, the joint is known as the gomphosis, okay. Now our teeth, they are held firmly into their places, in their position. They are fixed at one place, okay, in the upper jaw and the lower jaw, and the teeth are not moving that much, okay. Slight movement is possible. So how the slight movement of our teeth is possible, and how the teeth are held firmly in their place? So there is a ligament called fibrous periodontal ligament, and with the help of this periodontal ligament, the teeth are held firmly into their places in the socket, okay. I am showing you, for example, over here, these are all periodontal ligament. These are all periodontal ligament. And what this periodontal ligaments are made up of? So they are made up of collagen fibers. Periodontal ligament consists of collagen fiber, and they, from where this collagen fiber or the periodontal ligament they are arising? So they are extending from the bone matrix, they originate from the bone matrix, and then they enter into the dental tissue. So from bone matrix they are originating, and they are entering in our dental tissue, that means in our teeth. From bone matrix to teeth, bone matrix, from bone matrix they are arising, and they are entering into our dental tissue, okay. Periodontal ligament. So this is the 9th point. Now in this figure I am showing you, so that you can see the okay, sutures. This is the suture. Between the suture, collagen fiber are shown. This is the periodontal ligament, okay, fibrous connective tissue. Fibrous connective tissue is a tissue in which collagen fibers are there. Okay, and this is the interosseous membrane between radius and ulna and tibia fibula. Interosseous membrane. Now 10th point, 9 point we have completed. See, now what this periodontal ligament they are doing. So when we are chewing our food, so we experience little bit of stress. Okay, so this stress is bear by this periodontal ligament. Okay, then in our teeth the nerve endings are there. Okay, and these nerves and periodontal ligament, with these two things, periodontal ligament and the nerve ending, we can experience the movement of our teeth, or we can experience how hard we are biting our food substances, or just in case any food particle is stuck in between, so that food particle will be touching the periodontal ligament, and we know the periodontal ligament is penetrating our teeth, and in our teeth the nerves are there, so we can get the sensation that the food particle is stuck in between our teeth. Okay, so the function of periodontal teeth, that one thing, it is fixing our teeth in the socket. Second thing, the sensation of the chewing and biting, and anything which is stuck in our teeth, so we can feel that stuck particle due to this periodontal ligament. Okay, these are the function of periodontal ligament. Then last type of fibrous joint, syndesmosis. Now what is syndesmosis? First of all, a syndesmosis is a fibrous joint. Okay, and in this type of joint, two bones are bound by long collagenous fibers, and since the collagen fibers are long in this type of joint, uh, the bones are more mobile. So this joint, syndesmosis joint, which is having long collagen fiber, is providing more mobility to the bones of the joint when we compare to sutures or the gomposis. So in the sutures and gomposis, there is hardly any movement, or we can say there is no movement. In teeth, very little bit movement is there, and in suture, very less movement is there. But in case of syndesmosis, there is a good amount of movement or mobility between the bones is observed. Now, where this syndesmosis is present? So first of all, here now this is the 12th point. You can read this, and I am directly explaining to you this point. First of all, syndesmosis is present at two places. First is radius and ulna. So between the radius and ulna, these collagen fibers are present. So it is said that from the larger bone, the collagen fibers arise, and then they attach to the smaller bone. So here the larger bone is the radius and the smaller bone is ulna. So we can say that from radius the collagen fibers are arising and they are attaching to the ulna. So in between this collagen fiber sheath is present, These collagen fibers, they are very close together and they are in the form of the membrane. So this collagen fiber membrane is known as the interosseous membrane, and these collagen fibers are long enough, so they are providing, they are allowing the two bones to move freely. For example, this movement, supination. So you observe this, okay? So with the help of radius and ulna, we can do the supination movement, and we know radius and ulna, between the radius and ulna there is interosseous membrane, and the interosseous membrane is the example of syndesmosis joint. Okay, then one more type of movement, this movement. Okay, see the position of radius ulna. So which movement is this? So this is the pronation. So pronation movement is possible due to the syndesmosis joint between radius and ulna. Okay, then this is the tibia, this one is fibula. So between the tibia and fibula, interosseous membrane is there. Okay, and at the distal side of tibia and fibula, here you can see the ligaments are present. Okay, so what this ligament are doing? So see, joint held together by a ligament. So here there is a joint, syndesmosis joint. Okay, and this joint is held together by this ligament. Okay, due to the presence of this ligament, this interosseous membrane is not going to torn up. Okay, it will remain as such. So this is the this one is the last point of our discussion, syndesmosis joint. So for syndesmosis, we are remembering that between radial ulna and tibia fibula, the interosseous membrane is present, and it is permitting such movement. For example, the pronation and the supination of the forearm. Okay, so with this we have completed this presentation lecture on the fibrous joint. Before I wind up this presentation lecture, I would like to show you all the figures. So if you have any doubt, you can go through the figures. Okay, so with this we have completed this presentation lecture on fibrous joint. I hope you have enjoyed this presentation lecture. And I also hope that this presentation lecture will be helpful in your exam preparation and also in your studies. My name is Manish Kosti sir. I am from Ahmedabad, India. Bye bye. Namaste.